আমাদের সমাজ জীবনে চলার যে সমস্ত রোগগুলো আমাদের শরীরের মধ্যে বাসা বাঁধে
যেগুলো আমরা কমনলি যেগুলোতে আমরা সাফার করি, যেরকম ব্লাড প্রেশার হয়, সুগার হয়, থাইরয়েড হয়, সেটা। তো এই সমস্ত ডিজিজগুলো, these are called as lifestyle disease, and also anxiety, stress, they are also lifestyle diseases. So yoga helps us to fight these lifestyle diseases. So when I practice in my day-to-day life, I went inside his trachea. He was unable to breathe. ওর বাবা মা ওকে শ্বাসকষ্ট নিয়ে আমাদের কাছে নিয়ে এসেছিল, সিভিয়ার শর্টনেস অফ ব্রেথ. So what we did, immediately we shifted the boy from the emergency to the operation theatre. We gave anesthesia to the boy and we removed the 2 rupees coin. And you know what? After that, the respiratory distress, the breathlessness was relieved. বাচ্চাটার শ্বাসকষ্ট থেমে গেল. And we shifted the boy to ward and eventually he got discharged. In the other picture, this is a 34-year-old woman from Durgapur, a nearby locality of our hospital. She came with a snake bite wound. This is a poisonous snake bite, and we observed that the patient was clear-cut signs of neurotoxicity. So we had given her anti-snake venom injection, and eventually we treated her as per protocol, and she was also cured and got discharged. So the message that I want to convey, that these are the situation which we call as emergency situation, apatkalin obostha, right? So these are the emergency situation in which modern medicine is inevitable. You have no other option other than the application of modern medicine. You will have to go to a doctor, you will have to go to the emergency of the hospital. No, so for these kind of situation, I do feel modern medicine is the only choice you have. But you see this patient, I am measuring blood pressure of this patient. This is a 54-year-old patient from Durgapur. She suddenly one day started having a right upper abdominal pain. And in her USG report, it was shown that she was having stones in her gallbladder. So general surgeon recommended her a surgery called as laparoscopic cholecystectomy, which means they wanted to remove her gallbladder to relieve her from that pain. You know of that surgery? Anybody? Please raise your hands. Laparoscopic cholecystectomy. So that patient was posted for lap chole, and she was sent to me by our surgeon. And she was not taking any medicine. She was completely all right. ওনার দুটো ছেলে ছিল, নর্মাল ডেলিভারিতে হয়েছে, কোনো সার্জারিও হয়নি আগে, ঠিক আছে? So when I measured her blood pressure, I found her blood pressure was 200/110 millimeter of mercury. Now anybody knows what is our normal blood pressure among the students? Sir? Yes. So according to the American College of Cardiology, our normal blood pressure is 120/80 millimeter of mercury. So the blood pressure was highly raised. At the same time, when I do some investigation, I found that she had very high blood glucose level also. And also, she was obese, overweight. At that point of time, I had to give her some medicine to lower down her blood pressure. Blood pressure কমানোর ওষুধ দিতে হয়েছিল. And also I gave her some medicine to control her blood sugar levels. But at the same time, I also advised her to do yoga. After 7 days, we did the surgery. Patient was discharged. But I met the patient after 6 months, and you know what? All her medications for diabetes, for hypertension was stopped. Even I was like, how did you do it? She said, madam, you gave me those medicines. I used to take those medicines, and I used to I joined a yoga clinic. I used to practice yoga daily. ও রোজ yoga করতো, আর 6 মাস পরে দেখা গেল যে ওর প্রেশার আর ব্লাড সুগার both were controlled without any medication. So her doctor, her nearby local physician, he tapered off all her dosages, all her drugs, and eventually it was stopped. Kale yoga has the potential, no, you believe it or not? Yes. Yoga has the potential to cure all your lifestyle diseases like diabetes, hypertension, obesity. Even she was asking about migraine. You were asking about migraine, no? So yoga has the potential to treat all these kind of lifestyle diseases. So how yoga is doing this magic? This is some sort of magic, you know. So how yoga is doing it? Let us understand by physiology. So let us understand by physiology. this organ, anybody knows among the students? Yes, this is our heart. And you know the muscle of heart is called as myocardium. So when you practice yoga for a prolonged period of time, it increases your myocardial contractility, meaning the pumping action of the heart. So if your heart is able to pump more, it is able to increase your blood circulation. More blood will be ejected through the heart to your entire body. And also, if you practice yoga for a prolonged period of time, it will make some favorable changes in your heart rate that will prevent you from having a myocardial infarction that we commonly call as heart attack. Okay? It will also help you to reduce your blood pressure. In the next picture you see this organ, anybody knows?
Lungs.
Yes. So these are our lungs. So when we do yoga, we do a lot of controlled breathing. Previously, sir and ma'am has explained that we are doing pranayama, yogic breathing. So in controlled breathing, more amount of the air is going to inside your lungs. So more amount of the air is going inside your lungs means it increases your vital capacity. It is increasing your total lung capacity. মানে আমাদের লাংসের কর্মক্ষমতা বাড়িয়ে তুলছে, তাই তো? তো it has the potential to heal your diseases such as asthma. You know about asthma? Any people in here suffering from asthma? Yes. So it has the potential to heal your bronchial asthma and other lung diseases like interstitial lung disease, emphysematous lungs. These are all sorts of lung disease which can be healed by practicing yoga. Now আমাদের যে সৈনিকরা আছে তাদের আমাদের যে ডিফেন্স সেক্টর বলে একটা সেক্টর আছে, তোমরা কি মনে হয় আমাদের বাজেট কি ডিফেন্স সেক্টরে? রিসেন্টলি ভোট হয়েছে, ইলেকশন হয়েছে, বাজেট কি রকম ডিফেন্স সেক্টর? বেশি না কম? বেশি. So people do spend a lot in our defense sector because those are our armies. Those armies are fighting for our country. If any attack happens from Pakistan, our army will go and fight for our country. No, that is similarly in our body also we have an immune system. In immune system there are certain cells like neutrophil. Whenever a bacterial invasion happens in our body, these immune cells fight for us. Okay, they fight for the for cure of the disease. So what happens, as I said previously, yoga is increasing your overall blood circulation. So blood circulation means our blood is carrying two things. One is, yes, very good. Who told that? Very nice. Oxygen. Another one is, that is removing the gaseous exchange, and another one is nutrients. Oxygen and nutrients. It is supplying oxygen and nutrients to all over our body. So our defense cells will also get more oxygen, more nutrients. তাহলে সৈনিকদেরকে যদি বেশি খাবার দেবে তাহলে তারা ভালো পারফর্ম করবে কি খারাপ পারফর্ম করবে? ভালো করবে। Yes, they will perform better if you feed them more. They are getting more oxygen, more nutrient supply. So your immune system improves. So that is why they say that yoga and immunity go hand in hand. It improves your immunity power. Similarly, you can see this is our digestive system. So inside our digestive system, there is secretion of several digestive juices, which helps for digestion. So if you practice yoga, there will be more secretion of digestive juices, and it will help you to digest better and improve your gut health. You can see this bone. This is which part? Which part of the body is this? Knee. This is our knee joint. So sometimes patients do come with knee pain, swollen joint, arthritic joint. So if we advise gentle yoga for those patients, what happens? It will increase blood supply, as I explained earlier. So it will help them to heal from that disease. So it will help them to ease their discomfort and pain also. And also for women, if we practice yoga for a prolonged period of time, it will help to heal our osteoporosis. You see this bone? This bone is a normal bone. And this is an osteoporotic bone. Osteoporosis means loss of your bone mass density. Okay? So because of the fact that women suffer more, because we have a menopause in our life journey, we have a menopause is cessation of our menstrual cycle. Because of certain other factors like calcium deficiency, vitamin D deficiency, we suffer from this osteoporosis more than a male patient. Female patients do have more chances of development of osteoporosis. So for all the female who are present here, if we do if we do yoga regularly, it will prevent the occurrence of osteoporosis in our body. You see, these are our neurons. So yoga is supplying more blood and oxygen to our brain also, so our brain will function better. You will feel energized throughout the day, more focused, and also your energy levels will be high. It will relieve your mental anxiety, tension, and all of that. And this organ, anyone can name this organ?
Pancreas.
Yes, very good. So this is our pancreas. So this is one of our endocrine system. Okay, this is one of our endocrine organs. So anybody knows why diabetes is caused? Diabetes can happen. Anybody? Yes, so pancreas has got a cell which is named as beta cells of the pancreas, and the insulin secretion through the beta cell is decreased, or even if the insulin is secreted, it is not working properly because of the receptor level. So if a diabetic patient practices yoga on a regular basis, what would happen? It will increase the blood circulation inside the pancreas, and it will help the pancreas to secrete more insulin. And insulin is balancing your blood glucose level. So your blood sugar level reduces. That is why if a diabetic patient practices yoga, definitely his or her blood sugar levels will be reduced. And nowadays thyroid disorder is very common. Even I am taking also L-proxin 50 microgram daily. Anybody here is taking thyroid medicine? You are taking. So many people are suffering from this thyroid disorder nowadays. It has become very common. So if we do practice yoga on a regular basis in thyroid disorder, thyroid gland is located here. Okay, so if we practice yoga, then it will increase blood supply here. It will increase the synthesis of free T3 and free T4 hormones that we are taking in hypothyroidism from externally, which I named just, that L-proxin. That is a supplement of thyroid hormone. So it will increase its level and will help you to fight this hypothyroidism also. And in gynecology and obstetrics, I have seen application of yoga is really very helpful. So in gynae ops, many young women, every 1 out of 10 women of reproductive age group is now suffering from a disease called as PCOD, which is named as polycystic ovarian disease, where one of your ovaries are having multiple cysts. It is causing menstrual irregularities, it is causing them several other symptoms. It has been scientifically proven that if a PCOD patient practices yoga on a regular basis, it will help them to heal faster. And even in someone of you asked, pregnancy yoga, that question. Yes, that was a really good question, because in pregnant patients nowadays, in obstetrics practice, we recommend doing yoga regularly. Why? The reason is why. So the question is why. So the answer is that if you practice yoga in pregnancy, what will happen? It will improve your sleep-wake-up cycle. It will relieve your anxiety, your stress. And if you practice yoga in pregnancy, it will cause flexibility of the muscles which participate in childbirth. So the chances of you having a normal vaginal delivery will increase. Now the question, common question. So normal delivery is better or cesarean section is better? Anybody can answer that?
Cesarean.
Why? Because it is more physiological. Okay, the healing will be faster. You will be able to feed your newborn baby your colostrum milk, and also the bonding of you and your baby will be improved. The blood loss will be less. Several other benefits are there. But nowadays that trend is circulating everywhere that we want cesarean delivery. That is wrong actually. We have to focus on more physiological things, and yoga can help you with that, because it is giving you flexibility of the muscles which participate in your process of childbirth. Okay, so in pregnancy, doing yoga is really good. If you know somebody who is pregnant and wants to have a normal vaginal delivery, please encourage her to do that. Okay, and another domain of medical science where I found yoga has been really very helpful is psychiatric disorder, because as we all know that Guru Patanjali described yoga as Yogashcha Chitta Vritti Nirodha, which means yoga is that science or that technology which helps to calm down the agitations of the mind. And psychiatry is a field in the medical science which helps to cure your mental diseases, mild illnesses, right? So both these branches have a lot of common in their basic motive, দুটোই আমাদের মানসিক স্থিতির উপরে কাজ করছে, মেন্টাল ইলনেসের উপর কাজ করছে। Yoga is giving you mental stability, psychiatry is curing your mind diseases. That is why I believe that in psychiatric medicine, the application of yoga is really very important. As I mentioned also earlier that I was suffering from a state of depression in COVID times, and yoga helped me to come out of that without the help of any medicine. So yoga for mild and moderate cases, yoga is really very helpful. But for severe cases, now let me tell you one example. Okay, I'll tell it in Bengali for better understanding. So, আমি পিজি হসপিটাল সবাই জানে কলকাতায়, পিজি হসপিটালে একটা নিউরো সায়েন্স অফ ইনস্টিটিউট অফ নিউরো সায়েন্স আছে, বাঙ্গুর বিআইএন বলা হয়, বাঙ্গুর ইনস্টিটিউট অফ নিউরো সায়েন্স। সেখানে ডিপার্টমেন্ট অফ সাইকিয়াট্রিতে আমি কাজ করছিলাম। তো একদিন একজন মা আসে তার 18 বছর বয়সী মেয়েকে নিয়ে, এবং সেই মা বলেন ওই মেয়েটি 5 বার সুইসাইড অ্যাটেম্প্ট করেছিল, 5 বার। এবং লাস্ট টাইম কি করেছিল, শি ইনজেস্টেড আ বটল অফ ফিনাইল, পুরো ফিনাইল খেয়ে নিয়েছিল, কারণ ব্রেকআপ হয়েছিল, বয়ফ্রেন্ড ছেড়ে দিয়েছিল ওকে, সেই জন্য ও 5 বার সুইসাইড অ্যাটেম্প্ট করে, লাস্ট টাইম ফিনাইল খেয়ে নেয়। দ্যাটস ওয়াই শি ওয়াজ অ্যাডমিটেড টু আওয়ার পিজি এমার্জেন্সি অ্যান্ড উই হ্যাড টু গিভ হার আ গ্যাস্ট্রিক লেভাজ টু টেক আউট দ্যাট ফিনাইল। তো এই যে পেশেন্টটা, ফর দ্যাট পেশেন্ট আওয়ার স্যার ইন সাইকিয়াট্রি গেভ হার সাম মেডিসিন, কিছু ওকে ওষুধ দেওয়া হয়েছিল টু কাম ডাউন হার মাইন্ড। আফটার 1 উইক, এক সপ্তাহ পরে যখন আমি পেশেন্টটাকে দেখলাম, তখন দেখলাম যে পেশেন্টটা আর সুইসাইড অ্যাটেম্প্ট করছে না। ওর মা বলছে না, ও কিন্তু আর সুইসাইড অ্যাটেম্প্ট করেনি। তারপর ডাক্তারবাবু ওষুধটা খুব ভালো ছিল, কিন্তু একটা সমস্যা, আগেও আমাদের সাথে ঝগড়া করতো, মা আমার এই চাই ওই চাই, আমার বয়ফ্রেন্ডকে ফিরিয়ে দাও, এখনো সারাদিন ঘুমোয়, এখনো কথা বলে না, আর কারোর সাথে কথা বলে না। ওর একটা পোষা কুকুর ছিল, তার দিকেও তাকায়ও না। So this is the problem with only application of psychiatric medication, that it calms down your mind, the medicines, ওষুধগুলো তোমাকে ঠান্ডা করে দিচ্ছে, ঘুম পাড়িয়ে দিচ্ছে সব সময়, কিন্তু it is having a side effect that you are sleepy all over the day, the ability to connect socially is lost. So these are the points. That's why I do really believe that yoga should also be added to her treatment regimen. If you add up yoga to her treatment regimen, then she will be able to heal properly. Then our sir did, he asked her to do yoga, and he also gave a number of a yoga clinic, and she joined yoga, and after a few months when we met the patient, she was very happy, ও খুব হাসি খুশি ছিল, playful. She started learning Bharatanatyam. So this is the point, that if you are suffering from any psychiatric diseases, only addition of medical management, only taking pills and medicines will not help. That will cure your disease, but it will not help you to have a holistic health. For that, you need to advise yoga to her medical management. Another disorder is anxiety. Nowadays, we are suffering so much from this anxiety disorder. This is our sympathetic nervous system. So what happens if a patient suffers from anxiety? There is overactivation of our sympathetic nervous system. So to calm down this overactivated sympathetic nervous system, yoga is very helpful for this cure. Another disorder of psychiatry where yoga has been found to be really helpful is schizophrenia. It is characterized by certain symptoms, like this patient will develop certain misconception in his mind. তো একটা ছেলে ধর ওর স্কিজোফ্রেনিয়া হয়েছে, ঠিক আছে, তো ও ভাববে কি যে ওর বাবা মা সবাই ওকে মারতে চেষ্টা করছে, এভরিবডি ইজ ট্রাইং টু কিল হিম, কিন্তু এটা সত্যি কথা নয়, দ্যাট ইজ আ মিসকনসেপশন হি হ্যাজ বিল্ট ইন হিজ mind. So that is one symptom of schizophrenia. And also this patient sometimes gets violent, agitated. At that point of time, to calm down their mind, yoga is really very helpful. But the other aspect of schizophrenia is that this patient do not show empathy. ধরো সামনে ওর ঠাকুরদা মরে যাচ্ছে, মৃত্যু হচ্ছে ঠাকুরদার, কিন্তু সেই ছেলেটা কাঁদবে না, he will not shed a drop of tear. Why? Because he is unable to show his emotions, he is unable to express himself. So this is another area where yoga has been found to be very useful for this aspect of the disease. So if you advise yoga to a schizophrenic patient along with medications, I am not telling only yoga plus medicines, then it will help him to connect socially, to show his emotions. Okay? Another area where I do really believe that yoga is really very helpful in my practice is we deal with chronic pain. তো কিছুদিন আগে একজন পেশেন্ট আসে আমার কাছে, 50-year-old female patient, 50 বছরের মহিলা with severe back pain. ভদ্রমহিলা complain করছে that she is having severe back pain since last 6 months. So I did some clinical examination, some investigations like calcium, serum calcium levels, and also I had some routine basic investigation. And you won't believe, everything was normal, including her CT scan, her MRI. I could not find any cause, any visible cause why the patient is having that severe chronic back pain. So this is the area what we call as idiopathic chronic pain disorder. In this disorder, modern medical science is failed to find any particular cause. এরকম অনেকে জানে যে মা বাবা বলে ব্যথা আছে, কোমরে ব্যথা, খুব কোমরে ব্যথা হচ্ছে অনেকদিন ধরে. So this disorder, if you do investigations and you will not find any cause, these are chronic pain disorder which are idiopathic. So for this disorder, a particular yoga module has been developed for chronic pain disorder. And if you advise them doing yoga, it will help in their healing process. The American College of Physicians, they recommend doing yoga as a first line management for patients with chronic pain diseases. Now another area of psychiatry is substance abuse. Nowadays, I know many of you do smoke, now boys, many of you do smoking. So smoking is very common nowadays. Everybody thinks that smoking is all right. अरे एक सिगरेट से कुछ नहीं होता यार, एक दो सिगरेट पी लेते हैं. So cigarette smoking, alcoholism, people are consuming alcohol like it is normal. Every party you go, there are some people having alcohol and they are thinking it is fun. No, it is not fun. It is causing addiction in your body. Alcoholism, smoking, okay? And also people are doing drugs nowadays. Even we have seen in our Helpert Hospital clinic, many people from Durgapur nowadays is doing cocaine, is doing IV drug abuse. So I had the opportunity to ask one of cocaine addict patient. I won't name because he's a famous singer also. I won't name him. So I asked him that why do you do cocaine? Okay, so then he answered, it gets me to a state of high, madam. High. So that's why I started reading. What is high? What do you mean by high? High is a state of mind which gives you a state of deep relaxation. And you won't believe the magic that yoga can help your mind to go and touch that state of natural high. It can take you, it can give you to a natural high. If by doing yoga you are getting that peaceful state of mind, then the dependency on external substance will be reduced. So that is why yoga do really help a lot in de-addiction. But how yoga is doing this magic? Anybody knows the answer? How yoga is giving you that natural high of cocaine? Anybody knows? A chemical is secreted inside your brain by doing yoga. Name of the chemical? Endorphin. Okay? It is named as endorphin. We also call it as a bliss chemical. It is naturally giving you that peace of mind. By doing yoga, you are touching that peace of mind. So your dependency on the external substances reduce. There is an ancient text called as Yoga Vasishtha. And where in Yoga Vasishtha, a conversation between Lord Rama and his Guru Vasishtha is written. When Lord Rama was in a state of utter depression, he did not want to become the king. He asked his Gurudev, that Gurudev, if end of life is disease, death and suffering, then why to live? He asked this very basic question, that what is disease? Okay, so then his Gurudev, Guru Vasishtha, gave him very good answers, very clear-cut and lucid answers. He said, any disease that manifests at the level of body is called as Vyadhi. Now listen to it very carefully because I'll ask question, okay? So Vyadhi is of two types. One is Anadhija and second is Adhija. Anadhija means illness of the body coming from outside, from the environment. Suppose a person have a sunstroke, heat stroke. So the cause is in the environment. It is coming from outside. Suppose somebody is getting an infection. Somebody got a tuberculosis infection in his chest. So it is caused by a bacteria named Mycobacterium tuberculosis, which is outside in the environment. You saw an accident in the Durgapur highway, and a motorbike accident with a car. A person got injured. So the cause is in the environment. So these categories of illness will fall in this category of Anadhija. Now tell me, if a boy gets mumps infection, 6-year-old boy, which category of illness it is? Anadhija. Okay? because the cause is mumps virus. But Guru Vasishtha said that the diseases where you are not able to find any external cause, it comes from within. She told us about migraine now. So migraine, any external cause? No. So it is the category of Adhija, right? So it is the Adhija category of illness where you are not able to find any depression. I told you that I suffered from depression at a point of time in my life. So what is depression in which category? Adhija. And some, yes.
Ma'am, but your depression was occurring by seeing the patients who are external. So it is the main
Yes.
reason is
Very good,
external
very good.
only.
So you are saying that external patient, so you might think that the cause is external, no?
Ma'am, and another thing that depression or any type of psychological thing, it is everything is related to external only because our emotional content comes from external
Yes,
only.
yes, yes. So let me please sit down. I saw an example while I was working in ICU. Many of my co-residents were also working, but I only got that depression. They didn't. They were working normally. So the factor is same, but why I got? Because it attacks your level of your emotion. Your emotion is involved in
Ma'am,
it.
it's kind of like immunity of your mind.
Yes,
Because
very
you are less
good.
immune.
So it is in the mind. So you agree it is inside you. Mind is in here only, inside us. So the cause is inside. So for all the Adhija category of illnesses, the cause is inside. So Guru Vasishtha said that it starts at the level of our emotion. Okay? Then it comes down to the level of our energy that we call as prana. And then the manifestation in the body will start. Okay, so tell me one example, hypertension and diabetes. What category of illness? This is Adhija. Okay, rabies virus infection, a dog bite and then rabies virus infection. What category? Anadhija. So that is how Vasishtha explained. Now Lord Brahma asked him that how does one get freedom from these illnesses? Disease to holo, then Guru Vasishtha answered that all the diseases which is caused by external environment, the causative factor is in the environment, will be treated by the agents from outside. মানে এনভায়রনমেন্টাল কজে যে সকল ডিজিজগুলো হচ্ছে সেগুলো এনভায়রনমেন্ট থেকেই জিনিস নিয়ে সারতে হবে লাইক হি রেকমেন্ডেড শাল্যা দ্যাট ইজ সার্জারি ফর দ্য ফার্স্ট ক্যাটাগরি অফ ইলনেস হি রেকমেন্ডেড ঔষধি মেডিসিন ফর দ্য ফার্স্ট ক্যাটাগরি অফ ইলনেস বাট হি অলসো সেড দ্যাট the other second category of illness where the cause is in the mind will not be treated by only agents from outside. You have to look deep within. This is the fault we are doing today. We are trying to cure the second category of illness also by agents from outside. Whereas in the second category of illness, we should look deep within. Guru Vasishtha recommended a technique called Pratiprasava. Pratiprasava means reverse delivery. It helps you to balance, to slow down the level of your emotion, which you are telling now, mind immunity. So it is slowing down your level of your emotion. And then it will slow down the level of your energy, balance the level of your energy, and eventually the manifestation in the body will be controlled. But nowadays, if what we are doing, I am having diabetes, I'll take some medicine for diabetes, I am having high cholesterol level, let me buy some medicine for cholesterol. But these are the illnesses which falls in the category of Adhija. It will be treated by Pratiprasava, that you have to look within and you have to heal yourself from within. Okay, so he recommended yoga. Doing yoga would help you a lot for the cure of this category of illnesses. Understood? So next, nowadays everyone has access to internet, right? Everybody is joining some random yoga program online and practicing yoga. But let me tell you one example. এই যে মানুষটাকে দেখছেন ইনি আমার পেশেন্ট 50 বছর বয়সী একজন ভদ্রলোক আমাদের কাছে এসেছিলেন with a fracture of left side of his humerus. বাঁ দিকের humerus fracture. Humerus is this bone of arm. এটাকে humerus বলে। এই বোনটা ফ্র্যাকচার হয়ে গেছে। I asked কাকু আপনার এটা কি করে হলো? পড়ে উনি বললেন I was practicing some advanced yoga. কিছু অ্যাডভান্স যোগা করছিলেন and he fell on the floor and he got this fracture of his humerus. So this is wrong. Okay, wrong means you are practicing advanced yoga without the supervision of any trainer. You are not learning it from some authenticated source. So if you want to learn yoga, please learn it from some authenticated source. Okay, a person who is having a degree on yogic science from a registered university, then only you start practice doing yoga. Okay, otherwise this kind of problem will happen. The other day, I was reading a study on NIMHANS. NIMHANS, you know anybody? NIMHANS is a famous institute in Bangalore. It is a neuroscience institute. So they did a study on medications. They, in a shopping mall, they gave 700 to 770 educated people. They give them questionnaire, and it was found that 70% of the educated people think that it is completely alright to buy these medicines without any doctor's prescription. Painkillers, opioids, antibiotics, and sleeping pills. Now, the common attitude in our common mindset is, আরে আমার একটু ব্যথা হচ্ছে, কোমরে ব্যথা হচ্ছে, দাঁতে ব্যথা হচ্ছে একটু, এনিথিং, আরে হাঁটুতে ব্যথা করছে, মা বলছেন হাঁটুতে ব্যথা করছে, আমি চলে গেলাম দোকানে, আরে কিছু ওষুধ দিন দাদা, ব্যথার ওষুধ দিন. We are buying these painkillers without any doctor's prescription, and these painkillers, the painkiller is harming your kidneys, and this patient is coming a few months back with a kidney failure. We have to give her dialysis. So buying these medicines without any prescription is wrong. I will take the opportunity to emphasize here, please don't buy these medicines without any doctor's prescription. আরে গলা ব্যথা হচ্ছে, তুই বন্ধুই বলে দিল, আরে ভাই তোর গলা ব্যথা হচ্ছে, অ্যাজিথ্রাল 500 খেয়ে নে, ও ছেড়ে যাবে, গলা ব্যথা ছেড়ে যাবে ভাই. So he goes to the nearby medical shop and he buys that azithral 500. He doesn't even know that it can cause multi-drug resistance in his body. So if you are not feeling healthy, please go to a doctor, and if he advises you buy this medicine. So be it doing yoga, be it having a medicine, you must go to a doctor. You should take a prescription, or you must go to yoga consultant, learn yoga properly, then only you do it. In Bhagavad Gita, there is a sloka. It says samatvam yoga uchyate. It means that yoga is that flexibility of the mind, body, which helps you to balance your mind in all situations of your life. So our mind and body is connected. Do you agree to that? Yes. Mind and body is connected. So if we practice the flexibility of our body, then it will give us the flexibility of our mind. It will help us to deal with all the difficult situations of our life. It is helping us to balance our mind. But in today's world, people are busy, building up packs. I have 6-pack, I have 7-pack, I have biceps, triceps, trapezius. They are hitting the gym, practicing, drinking up protein shake after protein shake. So they are becoming obsessed with the body. I'm not telling that going to the gym is wrong. Okay, going to the gym is okay, but the focus should be on what we learned in Bhagavad Gita, is in the mind. The purpose of the flexibility of the body is to achieve the flexibility of the mind, to balance your mind. So the purpose, if you want to practice yoga, please know that the purpose of doing yoga is to generate extraordinary potential in the mind, to deal with all your difficult situations of life. So let me tell you one example. A few days back, this woman, you can see, this is a 70-year-old woman. She joined a community yoga program. She started doing yoga, and she was taking 4 medicines. She was my patient. She was taking 4 medicines. One is a blood thinner, name is Ecosprin, 75 milligram. Second, it was a anti-hypertensive medicine, Telmisartan, 40 milligram, Telma 40. She was taking a medicine for blood sugar level, that is oral hypoglycemic agent, and also injection insulin to control her blood sugar level. And also she was suffering from dyslipidemia, high cholesterol level. So she was taking these medicines, okay. She joined this community yoga program because somebody told her that it will heal all her diseases. This part is absolutely okay. Yes, she did right, no? She did right, yoga join to heal her diseases. This part is right. But the day she joined this program, she stopped taking all her medicines. And this patient ended up in our ICU with a state of diabetic coma. Diabetic ketoacidosis is a situation when your blood sugar level is so high that it gets you to a comatose state. So this part is all right, that she joined yoga program to heal her diseases. But this is not okay. If I join some yoga program and I'll think that it is some mystical science, some magic would happen, from tomorrow I'll join yoga program and I'll stop all my medicine. This is not okay. It will take time, okay? With a prolonged period of time, it will help you to heal from all of your diseases. But it will not happen overnight. It will not happen in a day. It is not magic. It is a science, no? So with a period of time, definitely all your medicine will be reduced. You have to go to a doctor and strategically, systemically, the doctor will reduce the dosage and eventually all your medicine will stop. So definitely, I want to give here a message that definitely yoga will heal your hypertension, your diabetes, your dyslipidemia, thyroid, everything I mentioned here. But it will take time. It will not happen overnight. So overnight stopping your medicine will not help you. Okay, will harm you more. Gradually, in a systematic, scientific manner, all the dosages will be reduced and you will be free from all these diseases. But it will take time. So what happens when we practice yoga? Our lifestyle is regulated. Our sleep, wake up cycle is regulated. In normal life, আমরা stress, anxiety তে ভুগছি। কখনো না কখনো কিছু না কিছু মাথাতে চলছে। এই যে আমি এখন বলছি, কেউ কেউ অন্য কিছু চিন্তা করছে, এই আমার 5টার সময় অ্যাপয়েন্টমেন্ট আছে গার্লফ্রেন্ডের সাথে এখানে। এই চিন্তা করছে কেউ কেউ। So these people are basically something is going in our mind only, no? So if your lifestyle is regulated, if your sleep, wake up cycle, this anxiety, this tension is regulated, your stress level reduces, if you feel healthy, so definitely you will be free from all the diseases and all the medicines will be relieved. Thus, yoga, I believe, is very cost effective. And what you need is basically a yoga mat and some blocks, a chair. Okay, and in our medical school, we were taught that all medicine we take do have some or other kind of side effects. But yoga is a medicine that do not have any side effect. Okay, and also it is very much, supportive and adjuvant therapy to our routine medical management. So I do really feel that integration of yoga and modern medicine should be there. And in our hospitals also, we must recruit yoga consultants. So for the students who are learning yoga, please learn it with your heart and soul. And please work with us also in medical field. Along with us, you read heart and soul, and we hope in near future, it will happen that in our every medical unit, every surgical unit will have a yoga consultant with us. And who will work with our surgical and medical team, who will put individualized plans for each of our patients. Okay? So in conclusion, what I want to convey is yoga is for all ages. A young boy, a young girl can also do, a little baby can also start doing yoga. It can, you see in this picture, it is her mother-in-law and daughter-in-law. Normally they do not get along. Okay, শাশুড়ি আর বৌমার তো পটে না খুব একটা, কিন্তু they are doing yoga together in a community. Okay, so yoga is for all ages. For all age group, yoga can be done. It will give you mental and physical health benefit. So it transformed my life. It can transform your life also. It can broaden your horizons in ways you had never imagined. So thus I will conclude my lecture. Hope it helps you a lot. Thank you so much.
Thank you so much, madam, for your valuable words. The practice of yoga is believed to have started with the very beginning of civilization. The science of yoga has its own origin thousands of years ago, long before the first religions or belief systems were born. Now, we are moving on towards a session on history and culture of yoga in India. Our respected speaker of this session is Dr. Porichiti Saha. Dr. Porichiti Saha is a distinguished expert in the field of yoga therapy and naturopathy with an impressive academic background and extensive research experience. She holds a BA in naturopathy and yogic science from the Sri Sri University and MSc in yoga therapy from Swami Vivekananda Yoga Anushandhana Samsthana and a PhD from Indian Institute of Technology, Varanasi. Additionally, Dr. Saha is a certified level 1 and 2 yoga wellness instructor and an acupressure therapist. Dr. Saha's research focus on the effect of Brahmi Pranayama and Shambhavani Mudra, as well as the impact of yogic practices on the working memory of school students. Her contributions to these areas are well recognized through her numerous publications. She has been invited to deliver lectures at prestigious institutions such as Pathabhavana at Vishwabharati University and Arogam Yoga Healthcare and Research Center, where she shares her deep knowledge and insights on yoga therapy and wellness practices. Dr. Saha continues to inspire and educate others on the benefits of yoga and holistic health. Without starting her session, I would like to invite Dr. Deep Kumar Das, Head of the Department Yoga, to felicitate our honorable speaker, Dr. Purichiti Saha. Sir, please, madam, please. Thank you, sir. Thank you, madam. Without further delay, I would like to request Dr. Purichiti Saha to share a few words on this occasion. Madam, please.
So, very good afternoon to everyone, to all the esteemed participants. I express my heartfelt gratitude to the NSHM College for inviting me in this session. So, without wasting any time, I'll just move ahead for my topic. Today is History and Culture of Yoga in India, Understanding its Origin and Evolution. So till now, we were actually learning about the benefits of yoga, the physiological aspects, the therapeutic aspects, its effects on health. So, which is most important, that it is very important for us to know that how this knowledge of yoga came into the human scenario. So today, this is the overview of my session. I'll be talking about introduction to yoga, origin and history of yoga, classical texts, types of yoga, its cultural significance, and ultimately the conclusion. So as we all know, yoga is derived from a Sanskrit root word yuj. Yuj means to unite. So in Rig Veda it is said, yujyate anena iti yoga. That which unites is yoga. So this unite or union, it is between the Atma and the Paramatma, that is the individual consciousness and the supreme consciousness. And it can be, that is actually the sole purpose of yoga, which we talk about Atma Gyan or the self-realization. When we realize ourselves, we will be able to understand, we will be able to develop that sense of oneness with ourselves and our entire universe. That is the actually sole purpose of yoga, or you can say Vasudhaiva Kutumbakam. The entire world is one family. So for that purpose, the tool is harmony between body, mind and soul. Whenever there is a balance between our body, our emotions and our soul, that is only the technique to reach that state of yoga. And we shall learn what are the yogic techniques to reach that state. And the knowledge of yoga are said to have originated from the Vedas. So what is Vedas, that we'll learn later. So Vedas are actually the prime source of knowledge of yoga. And it helps us to develop that state of mind which Maharishi Patanjali says to we as Chitta Vritti Nirodha. I hope everybody knows what is the meaning of Chitta Vritti Nirodha. Right? Chitta means mind. Okay, chitta is translated to be as mind, and vrittis are, you can say, the waves or the replications or the waves which are going on in our mind, the mental modifications. So Maharishi Patanjali, he has categorized this mental modification into 5 types: Praman, Viparyaya, Vikalpa, Nitra, and Smriti. Praman means the source of right knowledge are known as Praman. Then Viparyaya is the, you can say, wrong understanding or the false understanding. And Vikalpa, it is imagination or misconception, Nidra is sleep, and Smriti is memory. So Maharishi Patanjali says that these 5 vrittis, it is need not be, it is always bad. It is actually both two in nature, painful and non-painful. So it depends upon us how we use it. For example, you know music, right? So music has two natures. It can lead you to your deterioration or it can elevate you. If you use music for the sake of sadhana, then it will help you to elevate your consciousness. But again, the same music, if you use for, you can say, in nowadays there are some music which are coming up with slang languages, bad words, abusive words, it can lead to deterioration of your mental health also. So it is again, vrittis are dependent upon us how we use it. So Yoga Chitta Vritti Nirodha says to control these modifications of mind and make our mind one pointed. That is the actual meaning of Yoga Chitta Vritti Nirodha. And again, it also addresses the principles of karma and dharma. Karma is your actions, how you should be performing your actions by following the righteousness, the morality, the duty, what should be done and should not be done. And it is again based on the ethical principles of yam and niyam. Do you know about yam and niyam? Yamas, the do's and the don'ts. So in Ashtanga Yoga, it is said that yamas are the social disciplines which we need to follow for the society. That is ahimsa, satya, asteya, brahmacharya and aparigraha. Ahimsa is following non-violence towards yourself as well as others. Satya is following truthfulness. Asteya is non-stealing in nature. Brahmacharya is basically, the word brahmacharya means constantly being in the thoughts of Brahman or the universal consciousness, and ultimately aparigraha. Aparigraha in simple terms you can say leading a non-luxurious life. Means whatever is there you are happy with that. And if you are gaining any unnecessary things, you need to donate it. And niyamas are the fixed disciplines which you need to follow for yourself. That is Shaucha. Shaucha means you need to keep your body and your mind clean and purified. Santosh means satisfaction. Whatever is there, you are happy with it. Tapas means austerity. Penance means undergoing some uncomfortable situation, knowing that it will give you some good in the end. That is tapas. Then Swadhyaya. Swadhyaya means observing yourself, studying your own self, and ultimately Ishwar Pranidhana. Ishwar Pranidhana is surrendering yourself to the Ishwar, to the God, which helps you to nullify your ego. Okay, so these are the some of the basic principles on which yoga is based. Next, we will see the origin and history of yoga. So generally we know that the father of yoga is known to be as Maharishi Patanjali. It is said that Maharishi Patanjali was the first person who have compiled the knowledge of yoga. But actually the first propounder of yoga is Hiranyagarbha. It is written in Brihad Yoga Yajnavalkya Smriti, and also in Mahabharata. The contexts are found that Hiranyagarbha was the first propounder of yoga. Now, who is Hiranyagarbha? Actually, if you go by the Puran or the Smriti, there are actually 7 types of Hiranyagarbha mentioned. Among them, there is Lord Brahma. Lord Brahma is also known as Hiranyagarbha. But here we will learn Hiranyagarbha is actually known as the Surya Dev, the sun god. So it is said that Rig Veda and Yajurveda says that Hiranyagarbha was the first being who came into existence before the start of creation. It is also mentioned in the Brihadaranyaka Upanishad that Hiranyagarbha came into existence before the start of creation, and from him all the celestial beings were born. Celestial beings like moon, stars, graha, nakshatra, stars, everything were born from Hiranyagarbha. And it is known that he is known as the first propounder of yoga. And if you go by Bhagavad Gita, have any of you read Bhagavad Gita? How many of you have read Bhagavad Gita? It's very, actually, you can say disappointing that Bhagavad Gita is such a integral text of our culture, and we just buy Bhagavad Gita and we just keep it in our, you can say, puja room. Okay, so Bhagavad Gita, it is actually the way of life. Do you know in MBA, the students are made to learn Bhagavad Gita in order to learn professional ethics.
Right.
In order to learn Karma Yoga, professional ethics, Bhagavad Gita are made to learn to the students. So Bhagavad Gita is a complete text. So anyways, in Bhagavad Gita in chapter number 4, first shlok, Shri Krishna says to Arjuna, actually Arjuna asks Krishna, how do you know so much thing? In entire 18 chapters of Bhagavad Gita, Krishna says to Arjuna that why you need to follow your duty, why you need to fight against adhar. In order for that, he explains the concept of yoga to Arjuna in the 18 chapters. So in 4th chapter, Arjuna asks to Krishna that how do you know such things like yoga and everything? How did you get the knowledge? What is the origin of yoga? So in reply to that, Shri Krishna says that I was the only one who instructed this knowledge of yoga to Vivashwan. Vivashwan is none other than the Surya Dev or the sun god. And from Surya Dev, this knowledge of yoga, it got imparted to Manu. Do you know Manu?
First man.
He was the first human. He was actually the first human whom Brahma created. Okay, Brahma created out of his mind. So Vivashwan instructed this knowledge of yoga to Manu, and from Manu it got transferred to Ikshvaku. You can also get the reference in Bhagavatam also, in Srimad Bhagavat Purana. You can get this reference. So this is actually the origin of yoga. And yoga, it was not like it was some text which was compiled or written. Actually, the source of yoga, which I have said, that it is the Vedas. Okay. So these are actually the time divisions according to the history of yoga. So there has been 5 time divisions. We will go from bottom to up. First was the Vedic period, which we also known as which also comes under the prehistoric times. Prehistoric times, everybody knows. Prehistoric times in Europe, it was known as the era of Stone Age and Bronze Age. Paleolithic age was the prehistoric era. And then Sutra and Mahakavya period. Then we will talk about age of Tika and Vrittis. Tika and Vrittis are the commentary ages. Then we have age of Hatha Yoga and Bhakti Yoga, and then the modern age. So the Vedic period, it starts from the period of the creation of universe up to the 6000 BC. And this Vedic period, it is again categorized into 2 types, that is early Vedic period and later Vedic period. Early Vedic period was actually considered as the prehistoric time, which was the Rig Vedic period. During that time, in the early Vedic period, Rig Veda actually was heard. So why I was saying that Rig Veda was heard? Because because another name for the Ved is Shrutis. Do you know this thing? That Vedas are also known as Shrutis. Why is it is known as Shrutis?
They passed by oral.
Oral transmission is actually Smriti. Ved is known as Shruti because the knowledge or the mantra of Ved was heard by the ancient rishis in their deepest state of meditation. They were experienced by the ancient rishis in the deepest state of meditation. Hence, the Vedas were Shrutis. Another feature of Veda is Aparushaya. When you will learn about the definition of Ved, you can see that Veda is known as Aparushaya, means which is not being created by any of the human. It was already pre-existing in the universe, and it was heard by the ancient seers in the deepest state of meditation. Hence, Vedas are known as Shrutis, and the rishis who have heard this knowledge, they came to be known as mantra drashtas, one who have seen those mantras. Okay, so this is how the knowledge of Vedas came into existence. And the first Veda which was formed, that was Rig Veda. So Rig Veda was the first and the old Veda which was pre-existing. And from there, again, the Vedas were divided into two types, that is Yajur and Sam Veda. So if you ask a Vedantin how many Vedas are there, they will actually say it is Veda Trayi, that is there are 3 Vedas. They, you can say, they hold the authority of 3 Vedas, that is Rig Veda, Sam Veda and Yajur Veda. Yajur Veda holds the applications of the Rig Veda, the ritualistic part, what should be done, what not to be done, how the rituals should be followed. It talks about the Karma Kand. And Sam Veda, it talks about the art forms, dance, song, music, all these holds the Sam Veda. There are also many Upavedas we will see. Okay, so basically this is the concept of Vedas. And then these Vedas were compiled. This knowledge of Vedas were compiled by Maharishi Vyas, and again it got categorized into 4 types, that is Rig, Sam, Yajur and Atharva Veda. Okay, and then it got orally transmitted from the Guru to the Shishyas. So these are the 4 classification of Vedas which you all know: Rig, Yajur, Sam and Atharva. Which I have already told, Rig Veda is the oldest of the Vedas. Yajur Veda holds the application part, and one of the Upaved or the branch of Yajur Veda is, you can say, Sthapatya Vidya. Do you know Sthapatya Vidya? Sthapatya Vidya is engineering and architecture. So engineering and architecture is a part of Yajur Veda. In Sam Veda, one of the branch of Sam Veda is Gandharva Veda. Gandharva Veda means that which deals with music and dance and other. And the 4th type of Veda which was formed later, that is Atharva Veda. So the knowledge of yoga is found in Rig Veda also, and also in Atharva Veda also. And there are also some traces of yoga in Yajur Veda too, the ritualistic part, that is the Karma Kand. And you know Ayurveda. How many of you know Ayurveda? Ayurveda is the science of life. So Ayurveda have also been said to born from Atharva Veda. Okay. Then these are the parts of Vedas. So these 4 Vedas which we have seen, that is Rig Veda, Sam Veda, Atharva Veda, Yajur Veda. All these 4 Vedas have 4 different parts which are known as Samhita, Brahmana, Aranyak and Upanishad. May it be Rig, Sam or Yajur, whatever it is, each and every Veda have 4 classifications: Samhita, Brahmana, Aranyak and Upanishad. Samhita part of Vedas, it consists of the mantras. Brahmana consists about the etymology or the meaning of those mantras. Aranyaka, it forms the bridge between the Brahmana and the Upanishads. And Upanishads are said to be the end of the Vedas. That's why it is known as Vedanta. And Upanishad actually contains all the essence, the entire essence of the Vedas, and they are known to be the most important part of Ved. And there are many Upanishads which talks about the concept of yoga. For example, Kathopanishad. Have you heard of Kathopanishad? Can you name some of the Upanishads? I think there are yoga students here, right? There are mainly above 1,000 of Upanishads are there, but around 108 in-print Upanishads are available. But if you are not able to read all those 108 Upanishads, you can go by 10 main Upanishads. Ishavasya, Kena, Katho, Atriya, Taittiriya, Chandogya, Brihadaranyaka, Taittiriya, Shweta Mundaka and Mandukya. Okay. So there are many Upanishads which talks about the concept of yoga. For example, Kathopanishad. Kathopanishad talks about the concept of Adhyatma Yoga. Adhyatma Yoga is that which in Bhagavad Gita Shri Krishna says to Arjuna, that is Yoga Karmasha Kausalam. Here he says that when you fix your buddhi and you make your mind one-pointed and all the senses are under your control, that is the state of meditation, that is the state of yoga. Same is explained in the Kathopanishad to be as the Adhyatma Yoga. Then after the Vedic era, we have the Sutra and Mahakavya period. In Sutra and Mahakavya period, it was a historic period from 600 BC to 600 AD. This was the period when compilation of Yoga Sutras took place by Maharishi Patanjali. So Maharishi Patanjali had compiled the Yoga Sutras in this Sutra and Mahakavya period. And there is also difference between the concept of Sutra and Shlok. In Bhagavad Gita, you might have heard that there are shlokas, whereas in Yoga Sutras, we talk about sutras. Do you know about the difference between these two? Sutras and shlokas. Shlokas are actually, yes? Yes. Sutras are actually comes from the word thread. Okay? Thread কি হয় একটার পর একটা কোনো মতি হচ্ছে একসাথে জুড়ে থাকে. Same happens in sutra. When you read Yoga Sutra, you have to read sequentially. You can't go in between and start reading. You won't be able to understand because it is all interconnected in nature. But in Shlok, it is not like that. If you start reading Bhagavad Gita from any Shlok, any page, you will get new knowledge. That is not an issue. And there is also another difference that shlokas are big. It is big in number. Like they have chandas, Prishtup Chand, Gayatri Chand, like that. But sutras don't have any chandas. So these are some major differences between sutras and shlokas. So in Sutra and Mahakavya period, first Patanjali Yoga Sutra took place, compilation of Yoga Sutras took place. And second, two Mahakavya which we know, that is the Ramayana and Mahabharata. These two Mahakavya composition took place by Maharshi Valmiki and Maharshi Vedavyas, which also consists the references of yoga. In Valmiki Ramayana, we can see the conversation between Guru Vashishtha and Ram, where he imparts the knowledge of yoga to Ram. Then Maharishi Vashishtha imparts the knowledge of yoga to Ram in Yoga Vashishtha, which is also a major text in yoga. And in Vedavyas also, in Ramayana also, you see many of the references of yoga in the Bhagavad Gita chapter, which is mentioned in the Bhishma Parva. And then Maharishi Patanjali, he also combined the Yoga Sutras. This Yoga Sutra, it has been categorized into 4 chapters, which are known as Padas. That is Samadhi Pad, Sadhana Pad, Vibhuti Pad and Kaivalya Pad. Samadhi Pad mainly talks about the types of Samadhis, the obstacles in sadhana, panchavrittis, removal of panchavrittis. Sadhana path talks about the ways of achieving that samadhi. Vibhuti path talks about the outcomes. Whenever you are practicing the sadhana, there will be some result or some powers given to you. So Vibhuti Path talks about those powers, and ultimately Kaivalya Path, which is one of the most important chapters in Patanjali Yoga Sutra. Kaivalya Path talks about the concept of liberation or moksha, and along with that it also talks about the theory of perception. How your mind works, how do you perceive things, how does the thought comes, how does the desire arise. Everything is mentioned in the Kaivalya Path. So this is the Sutra and Mahakavya period. After that, it was the age of Tika and Vritti. The age of Tika and Vritti was from 600 to 1200 AD. So in this age, mainly the commentaries of the Yoga Sutras came into existence. So first, Maharishi Patanjali had written the Yoga Sutras. He had compiled the Yoga Sutras. But after that, Maharishi Vyas had given a commentary of the Yoga Sutras, which is said to be the most authentic source till date, that is Vyasa Bhashya, Yoga Sutra Vyasa Bhashya. So in the age of Tika and Vritti, there were also certain commentaries which also came into existence, such as Tattva Visharadi Tika by Vachaspati Mishra and Raja Martanda Vritti or Bhoja Vritti by Bhojanand. Okay, so these are